Good morning, everybody. Let me introduce my PhD thesis title. It's the Management of Cervical Insufficiency. My name is Leila Tigharghar. I'm a second-year resident at the Department of Obstetrics and Gynecology at Semmelweis University. My vision with my topic is to make cervical insufficiency an easily manageable disease, and my mission is to find the most effective treatment for it by applying up-to-date scientific results. So currently I have two ongoing projects, which I would like to talk about in detail in the next few minutes. The first one is investigating the efficacy of different therapeutic modalities for cervical insufficiency on the prevention of preterm birth. I started this project in September, and it's a systematic review and meta-analysis. So let me tell you a little bit about the condition cervical insufficiency or incompetence. It's basically the asymptomatic dilation and the shortening of the cervix in the second trimester of pregnancy. On the picture you can see on the left side that's a physiological length of the cervix, and on the right side there's a pathological shortening of the cervix. Its incidence is quite low. It's 0.5% in the generic obstetric population, but it's 8% in women with a history of mid-trimester pregnancy loss. Risk factors can vary. It can be previous conization of the cervix, inflammation, infection, or laceration during a previous birth, or just a structural weakness of the cervical tissue. Despite having such a low incidence rate, its consequences can be pretty serious, including preterm birth and midterm pregnancy loss. Treatment is quite simple. It's either pessary, cerclage, or progesterone, and they're all easily accessible, but there is no conclusive result on which is the most effective one. So our aim is to compare the effectiveness of different types of treatments in pregnant women. That raises the clinical question, which treatment decreases the incidence of preterm birth caused by cervical insufficiency? We would like to investigate a population of pregnant women with cervical insufficiency, also singleton and twin pregnancies. And we would compare cervical cerclage, cervical pessary, and all forms of progesterone. And we would like to measure the outcome of preterm birth or miscarriage or stillbirth. And for secondary outcomes, we would like to measure length of pregnancy after said intervention and also early preterm birth. Our hypothesis is that all the interventions have a different efficacy on the length of the pregnancy. And with the optimal treatment, we can prolong pregnancy, and also since there are no clear guidelines on it, we hope to create new guidelines for treating this cervical insufficiency. So I conducted a systematic search in 4 databases. It resulted in over 5,000 hits, and the search key consists of the population and the intervention. So in the past few years, there has been quite a few new RCTs on this topic, which is great for us. This is just an example. It's a relatively large sample size from this year's multi-center trial, and its PICO framework fits perfectly with ours. So after the duplicate removal and the title abstract selection, we have 453 articles, and I'm currently in the full text selection part. So our second topic is connected to cervical insufficiency. It's investigating cervical insufficiency as a risk factor for developing pelvic organ prolapse. We started this project in October, and it's also a systematic review and meta-analysis. So just a little bit about the pelvic organ prolapse, what it means. You can see on the picture, it's either the descent of the anterior vaginal wall, the posterior vaginal wall, or the uterus, or some kind of combination of the three. The risk factors include obesity, chronic constipation, connective tissue disorders, and most importantly, vaginal delivery. The prevalence of the disease is quite high. It's 40% in women, and there are treatments. First-line treatment is conservative therapy, pelvic floor muscle exercises, and pessaries. But even with conservative treatments, 11% of women undergo surgery for this condition, and almost a third might need additional surgeries. So our aim is to assess cervical insufficiency as a risk factor for subsequent development of pelvic organ prolapse. And the clinical question is cervical insufficiency a risk factor for developing pelvic organ prolapse? We would like to assess the population of Paris women who have given birth before, And the exposure would be a history of cervical insufficiency. We would like to compare that to no history of the disease. And we would measure the outcome of development of pelvic organ prolapse. Our hypothesis is that a history of cervical insufficiency is associated with an increased risk of developing pelvic organ prolapse. And why is it important? Assessing the risk factors can facilitate early management, like conservative treatment, and it can help avoid future surgeries, which may be not necessary. So we conducted a preliminary search in 3 databases, resulted over 2,000 hits, and the first part is the population, and the second part is the outcome. So here is a great key article. We have mainly observational studies in this topic, but this is a great article. It has over 1 million participants, and its PICO is perfectly aligned with our PICO framework. So we have quite a few studies like this, and we don't really have any meta-analysis, prospective registration in this topic, which I'm very happy about. So to sum it up, I have 2 ongoing projects at the moment, and we plan to finish the first one by May next year and the second one by September next year. And I would like to end the presentation with the words of Marie Curie: "Nothing in life is to be feared, it is only to be understood. Now is the time to understand more so that we may fear less." Thank you.
I'd like to ask, how did those articles define cervical insufficiency that you've went through, for example, based on ultrasound diagnosis?
Yeah, thank you. It was quite tricky because most of the articles defined cervical insufficiency based on either an ultrasound diagnosis, a physical examination, or like a history of cervical insufficiency or mid-trimester pregnancy loss.
Congratulations to your presentation. I wonder, what was the exclusion criteria for your first project?
Thank you. So we wanted to create a more homogeneous population of pregnant women. So we excluded premature rupture of the membranes, women with uterine anomalies, or any kind of bleeding. So that's why we wanted to create like a more homogeneous population.
Thank you.
Congratulations. My question regarding the second subject. So my question is, which is the best treatment for patients with POP? Because it's a borderline surgery between urologist and gynecologist. So.
Yeah, thank you. So I don't think there's the best treatment. It's very it depends on the individual and depends on physical examination and ultrasound diagnosis. So I can't say for sure which is the best. It depends on each patient.
Your second question is clear. I'm just wondering what kind of preventing approach you can use. I mean, for prevention of the outcomes that basically you are investigating.
In the second project?
In the second.
Oh yeah. So basically, if we know if somebody has cervical insufficiency during their pregnancy, we can help with the screening, early screening for pelvic organ prolapse later.
And then?
And then conservative treatment in order
Which
to avoid
is?
pessaries or pelvic muscle exercises that can help strengthen the pelvic floor in order to avoid future surgeries or pelvic organ prolapse.
Is it a common practice, by the way, nowadays?
It is, yeah.
Okay.
You mean the muscle exercises or the pessaries?
Both.
Yeah, they are. They are.
Okay. And my other question is related to the first project. Are you planning to perform a network meta-analysis? Have you already checked the feasibility of network?
Yeah, I consulted with the statistician, and they're hopeful that we can do that. But
how many RCTs have you found so far?
A lot.
A lot. Okay,
Yeah.
that's great. Okay.
Yeah, I can't say an exact number because I haven't finished the full text selection, but a lot. But we are not 100% sure, but that's what we plan to do. I just didn't want to include it because it's not 100% sure.
Okay, and which method would you consider to be the best?
I'm not sure. I leave it to the expertise of the statistician.
Yeah, but based on the literature, probably you read a lot of articles.
Yeah, there are like 1 or 2 network meta in the topic, but most of them are just like a systematic review and meta-analysis.
Yeah, and based on these findings, which is considered to be the best?
I'm not sure. I think a network
Yeah.
meta would be great. So
Okay.
if we can, we hope to do that.
Okay. So that means the findings are quite different among the studies.
Yeah. Sorry. Yeah, they are like there's no conclusive results, so that's why we want to do it. And quite a few new RCTs have come up since the last meta-analysis. So we hope to have like a conclusive result with this study.